worked and strived for women to be educated, to stand up for their rights, to understand that they could too take control of themselves and this epidemic.
The Black community is made up of Native African Americans and a lot of Black immigrants, which include African immigrants, Afro-Caribbeans, Afro-Latinos, Afro-Europeans, and several other groups. So we focus on the African immigrant women because sometimes we realize that the national messages did not get transferred properly in the right channels to African immigrant women, mostly because we as African immigrant women don't have institutional knowledge.
We provide HIV testing and counseling. We link folks into care if their results come back positive. We also add in other issues like screening for STIs and for pregnancy. We also work at the intersection of HIV and violence against women because we know that the risks of both are sort of counteractive with each other in terms of women who are in violent relationships being more likely to be at risk for HIV.
Continuing to talk about being tested, continuing to talk about know your status, continuing to talk about good choices, continuing to talk about the fact that just because there's not this image of people getting thin and dying from AIDS, that it's still happening. And it's happening to us more than anybody else. And then I think within that is the necessity to make sure that we're talking about how African American women in particular are being affected by the pandemic, how poor choices within our relationships. And that's a conversation that I'm having more on college campuses than anywhere else, because I think that is where so many poor sexual choices are happening.
And so I go into local schools, middle schools and high schools. I have a curriculum that I've been implementing for the last 10, 15 years in LA County. And then I work with local community-based organizations such as sororities, substance abuse treatment centers, churches, and I'll go in and I'll again implement these HIV-related education and risk reduction programs.
Well, I think the first solution is that African American women and African descended women all over the world need to know that the images that we see every day aren't necessarily very positive when it comes to images that look like us, and that we need to redefine who we are if we're not looking at television or in the movies, and have very positive images around us to talk about Black sexuality and the Black body in our families, in our churches, in our relationships, so that our lives are based on what is real for us, not necessarily what someone else may think is best for us. And certainly if we've survived this long with the kind of oppressive histories that we've had, we certainly deserve to be healthy today.
Everything you do, everything you are contributes to your health. Your daily activities, the things that you put in your mouth, the way that you think about your body. So starting to look at yourself as not pieces of a person, but as a whole person makes the biggest impact, in my opinion, on leading a healthier lifestyle.
In my organization, at Sister Love, we have a saying, actually our motto is healthy loving is healthy living. And so we also have to have an approach, a positive, affirming approach to any relationship that we have, whether it's our relationship with our Creator, with our parents, with our family, with our coworkers, with our partners, with our children, with our neighbors. That if we don't examine how we relate, and is that healthy, and is that leading us to a better outcome today or tomorrow, then what is this relationship? Is it toxic or is it unhealthy?
Because sometimes the choices that we make are made because we don't feel like we have a whole lot of options in our intimate relationships. And so one of the things that we've worked to do is to empower African American women to take charge of their relationships and to begin to feel as if they do have options and they can both achieve and have healthy relationships. And part of doing that really does help us in the prevention of HIV. And it also sends a message about what is tolerated or shouldn't be tolerated, rather, in a domestic violence situation.
Pulling together more conversations with women and multi-generational conversations, and not multi-generational from the standpoint that only elders know stuff and young people don't. A collective conversation that takes the values and the legacy and the history and the experiences that I think elder sisters have, but some of the reality of current day challenges that young women have. I know that when my grandmother passed away at 70 some odd years old, she had no context of what it meant to be a 16-year-old at that time. But she could drop some jewels on you about what it meant to be a woman. And so I think we're missing those conversations a lot of times. A lot of times it ends up being elders talking at young people and young people saying elders don't understand, versus there being a mutual respect that each group is bringing something that's valuable to a discussion. And I think that has to be a discussion of women first. I think then
we as men need to be more proactive as it relates to taking care of the women in our lives, to encourage men to be responsible, to encourage men to be honest and upright.
Men need to have their own discussion about how do we view women, how do we view relationships, what's our value proposition of women, and how does that drive our relationships.
In terms of the things that they're in fact doing, which I would argue would lower the infection rate tremendously. I think, and that comes through personal responsibility and collective responsibility as a community.
Because HIV, the HIV and AIDS discussion, just in the vacuum of the virus, doesn't really get to why we're spreading it, how we're spreading it, how do we view ourselves, how do we view our sexuality, what kind of tool do we use sex for, what kind of decisions are we making in the process of having sexual relationships, when do we decide to use drugs, how do we decide to use those drugs. All those conversations speak to value propositions about who we are as men and women.
Well, I think the first step they've taken is to be here. And that's the first step, to be educated and aware of these issues and how they come together. The next step, I think, is for them to
talk openly, honestly, and frankly about the reality that HIV is a virus that is very prevalent in our community, that as African American women, they are at one of the highest risk groups for contracting HIV, so that we can't afford for women at this conference to come and learn about HIV and then to go out and remain silent because they're afraid of the shame or the stigma.
We have this other test that we're going to have to go through when we get through the pearly gates, and it's not going to be a test like anybody else. When we get up there, we're going to be met by our ancestors, and our ancestors are going to ask us one question and one question alone before we even get to St. Peter. And that question is, what did you do with your freedom? And I think that the way to answer that question is that you help somebody else. So if they can take the information they got from here and share and help somebody else, that's the best thing that they can do.
So it's not that much of a taboo among Black women, because the world needs us.